In places like this, courage lives in the quietest moments, in the hands that heal, and in the hearts that refuse to give up.
Why did you choose this line of work?
When I completed medical school and decided to do pediatrics, I was posted to the pediatric oncology unit, Korle Bu. The 26-bed capacity ward was filled with children affected by cancer. And even at the time, we would have patients come into the emergency room and wait to be transferred to the ward. And unfortunately, a lot of them came in when the disease was far advanced. It was very painful to watch. At the time, we also had a very brilliant consultant, now Professor Segbefia. One afternoon, after we had resuscitated a patient unsuccessfully, I asked her why she chose to spend her life doing this kind of thing, because it was just heartbreaking. She was very calm about it. And then she said, Nihad, this is not the face of pediatric oncology in the world. If you take the world statistics in high-income countries, 8 out of 10 children can be cured of cancer. The following day, I went back to tell her that I'll train to be a pediatric oncologist, because at the time, there were only 2 in Ghana. How did you expect 2 people to make a dent in what the scale of the problem was?
For some children, surgery is just the beginning of the fight.
What is preventing us from curing them in Ghana?
Cost of care is number 1 on the list. The second thing has to do with awareness, because they actually present like any other childhood disease.
She saw the gap, she carried it with her, and she wanted to do more.
Before we ended up at Ridge, we started very small. Anytime we hear something about a child who needs help or a child who needs help in paying their hospital bills and all that, we usually go for it.
So at first we're doing randomly. Anybody comes in, we just try and help if we can help.
Also, Kabute found himself at Ridge. He actually broke his feet on a motorbike.
So through circumstances, we got in touch with Auntie Winnie.
She was a nurse at Ridge Hospital,
who told us about the pediatric oncology unit.
She came to the ward and said, oh, Dr. Nihad, I heard you have some issues with paying bills. I said, Auntie Winifred, it's not bills. I need money to buy chemotherapy for children. So I got her an invoice. And the following day, she came counting money to give to us to pay for the medicines.
How did she do that?
The miracle was that she was linked to Pistis.
And through that, we got to know about Dr. Nihad.
A simple conversation became a lasting commitment.
So we kept sending her invoices to buy medicines. The medicines will come, she'll pay for it, take the receipts. It went on for a year. I had never spoken to the family that was doing this. I had never met them before, and they were so committed. They were responding. And let me say that it wasn't small money.
So we've been doing it for a while now and decided that, oh, this year's Women's Day, let's look for the people behind it and hear more about it.
In one space, hands create beauty and style. In another, hands help save lives.
When I was in training, I did part of it in India, and I was at Tata Memorial Hospital. So when a child came in and the parents had nothing on them, the child will get a diagnosis for free, will get treatment for free, accommodation, and they will have access to education. They will trigger an emergency fund. So when I came back, it was at the back of my mind that this is something that needed to be done. And then I was posted to the Greater Accra Regional Hospital, popularly known as Ridge Hospital. I was pointed to a room with very nice 4 beds. Oh, you can start.
It was Dr. Nihad who set up the pediatric oncology in Ridge Hospital. Most of the suspected oncology cases were referred to Korle Bu.
It was a challenge for the parents because you already settled in Ridge Hospital, you had bills to pay in Ridge Hospital, and then suddenly you were told you had to go to Korle Bu for further care. So Nihad came and was a whole game changer. And as much as we are happy that the patients were also being taken care of, we also learned a lot about oncology from her. including our residents who are also now being taught.
How's the center doing now?
The center is growing. Our patient numbers have grown from that single patient we started with in 2020 to more than 40 patients a year.
How are they able to afford the treatment?
When we started, I had to call on friends and family. In fact, we had to write letters to banks to help us even equip the units. We needed a machine. I was mixing chemotherapy myself and exposed to all the hazards of it. The fact is that if you don't start something, you cannot get people to help you. And there was a reason I went into pediatric oncology. This was part of the reason, to improve the access to care.
Nihad is a very committed specialist. Wherever she may be, when you call her at any time, she's willing to come.
When we established the pediatric oncology unit, for the first 2 years, we were losing 25% of the children to abandonment. They just get better. They've not finished the treatment and they stop coming. I knew from the experience that transport support is actually crucial. So I had to get people involved to help us fund transport as well. They may have chemotherapy waiting for them in the hospital, but how to get there becomes a problem. Now, supportive care can be more expensive than the cancer treatments. Exactly.
Surgery and so on.
Absolutely.
And this is why we need the help of the public.
Little drops of water make a mighty ocean. So you don't need to have 1 million Ghana cedis or 100,000 Ghana cedis. Even 1,000 cedis, even 100 cedis can go a long way to help improve a child's life.
Aside going to childhoodcancerghana.com, are you open to receiving donations at the hospital?
Absolutely.
And what specific donations can they bring?
So people can donate things like Pediasure or Ensure, which are milk-based drinks that we can give to them. We even accept infant formula, diapers, toiletries, and all those things. Some people even bring us bread and all of those things. We receive it and the families are very happy. Cancer doesn't choose where it goes, especially childhood cancer. It can happen to anybody. Let's build systems in our country that works so that we all know that one day, God forbid, when it is my turn, I have help. I know where to go. We need to do that.
Some women save lives. Some women build dreams. And some bring both worlds together so children can have a second chance at life.